Hello, I'm Dr. Lenore Walker, and I'm so happy to be here with you on our usual Thursday at 12 noon Eastern Time roundtables. We're a group of mental health professionals who are all involved in helping spread some important information about mental health issues during COVID. We work with the American Psychological Association and a number of the divisions that are part of that APA. And the two that are on this particular roundtable are COVID, interpersonal violence, and the international whole person approaches to treatment. So we have gotten together so that we can present you the best, the most recent and important information for those of us who are surviving over the last over a year now of COVID and the changes it's wrought to our lives. One of the areas that we're going to talk about today in the United States, it is Sexual Assault Prevention Month. And we're going to be talking about awareness of sexual assault today, particularly for women. Although we know that men can also be sexually assaulted, it's such a small number that we're aware of that most of our work really is in terms of helping women cope with all kinds of sexual assaults from the time they're little children and assaulted sexually as kids, all the ways up through the lifespan. So today we've got some very exciting presentations, and we have a number of our work group members who are participating. I'll introduce them to you, those who are on now. Others will be joining us. And after the presentations that Brittany and Patricia are going to be doing for us, it's going to help stimulate questions and ideas and discussion about what we find in our own work. And so you'll see other people will also jump on. We're also on live on Facebook. And this week it's working. Last week, Facebook changed their settings and we had some trouble getting live, although we've posted our wonderful video from last week as well. So please, those of you who may not have seen it yet, it's still up there. I checked this morning. So you can watch it, that Dr. Serlin put together on death anxiety. Unfortunately, we've had to face a whole lot of that during this pandemic as well. So let me introduce who's here. You met Dr. Giselle Gaviria, who's in Fort Lauderdale, Florida, where I am, as you can tell from my background. We also have Dr. Eileen Serlin, who's here with us from the Bay Area in San Francisco. We have Dr. Eleanor Partis, who's here with us from Israel, and Dr. Marilyn Safer, who's here from Israel. We have Brittany Geddes, who is going to be one of our presenters, and Dr. Patricia Villavicencio Carrillo, who is also one of our presenters. And we have Dr. Villavicencio is here from Madrid, Spain. You can see we're a very international group. And Brittany Geddes is here from Pennsylvania. And then we've got Dr. Michaela Mendelson, who is here from Boston. So we're across the country and we're across the world. You'll see some other people jumping on from different places as well. So with that, I'm going to introduce Dr. Villavicencio first. A longtime friend of mine. We met when we were both a whole lot younger, and I think Patricia was just finishing her doctoral dissertation. And we met in Europe at a conference, and we've been good friends ever since, working together. And she is now a psychologist working at the public hospital in Madrid, and she's also on the faculty of Complutense University in Madrid. I should know this because I've worked with her there. And so she is going to start, and then we're going to turn to Brittany Geddes, who is about to become Dr. Geddes. She has done her actual dissertation work on sexual assault. So we're going to really be privileged and honored to hear some of the work that she's been doing. So with that, I'm going to turn to Dr. Villavicencio, who is going to start us off.
Thank you so much, Lenore, for this privilege and honor to be part of COVID IPV. And we are such good friends, and you're my mentor. You already know that. This is a special month, and here in Spain, the 25th of April, it's also the day for prevention and attention to child abuse. And as you said, I work as a clinical psychologist and in Madrid at the Hospital Clínico San Carlos, and I'm assigned to the child and teenager mental health unit. And this is a very serious problem that women and girls around the world have. And we as women are target of sexual abuse, especially. As you said, Lenore, and kids, boys and men are also targets, especially during war. And a war as a rape as a weapon of war has been all around. And maybe if Harriet Adam joins us in Uganda, could tell us something about it. And I want to share something that happened to me during, as you mentioned, during my presentation. Well, and my research, my doctorate research, I started, as you know, and people who don't know me, I did my research on battered women. And during that time, I focused on mental health and using a stress model. And one of the stressors that I measured was one question that was, have you ever been sexually assaulted? And I did inform the people, the women that took part of my research project, that I did this question because at that time, that was a long time ago, in the 90s, already research showed data that sexual assault during childhood or during your lifetime in women impact in their psychological well-being. So there was only one question in my protocol, which was very long, and asking this yes or no question. And this question was one of the predictors that showed significant impact on, especially on psychological, how you call it in English? I just got blocked. Symptoms regarding psychotic, close to psychotic dimension in SL 90 revised. And this was amazing. It was only one question among other questions regarding also the type of abuse in their adult relationship. And the worst symptoms associated to mental health were those related to psychotic symptoms. We know that SL90 is not it's only it's not a diagnosis instrument, but tells you about where you can focus and assess a bit more. Okay, that's one thing. And my postdoc, I did not write that in my presentation, but I want to share this also. And in my postdoc, I did treatment. I offered treatment to women that have been abused in their relationship as adults. And the results showed us that women with sexual abuse experiences in their childhood, and women that did not have this type of background experiences in their childhood, at the beginning of the treatment, did not have any differences in symptoms, like depression. They were alike, anxiety, post-traumatic stress disorder, and so on. But what happened during the treatment follow-ups, that women that had been sexually abused in their childhood and teenage years had differences in the way they recovered. They took longer. And this is common sense, right? So we have to have this in mind, that when we have our clients or patients coming to our office and doing assessment, if we do not have this type of adversities and we don't measure this or ask them if they have ever been through this kind of experiences, they won't tell us. And they might not be aware that the symptoms or their, I will say, their mental health is related to the things that have happened in their past. So this is one thing that I just want to mention, and I will try to share. I just have 5 minutes, right? So I will try to share my presentation. Okay, and now, okay, and let me check. How can I? Oh, yes. Okay. So, unfortunately, okay, no. We all know that what sexual violence is, but let me mention it. Here in Spain, we have many resources. In Madrid, I have focused resources in Madrid. We have CABAS for the ones who live in Spain. Centro de Asistencia a Víctimas de Agresiones Sexuales. And for children, we have CIASI, and CIASI is the Center for Intervention in Sexual Abuse, Children's Sexual Abuse. And okay, so what we need to know here in Madrid, and resources regarding if we ever happen to have a patient and and share this information as in children's units, we have to write a report to the Madrid Family and Minors Institute and to the guard court, family attention and protection units and police. And as Eleanor said, the research shows that women and girls are more often attacked by someone who they trust, and they may be their father, relative, boyfriends, husband, or a partner. It can happen in the context of an intimate relationship. And they may have been sexually abused as a child by an adult, but they know. And let me, I don't know if I will be able to share this. Oh, let me check. Oh, I'm sorry. It takes too long. So let me go. Okay, this is a campaign against sexual violence against children.
No te calles, cuéntalo.
Oh, let me check.
Lo que voy a contaros ocurrió en una ciudad parecida a las demás. El nombre no es importante. Lo mejor es que ahí viven mis padres, mi familia, mis amigos. Todo lo que me gusta y todo lo que quiero está en este lugar. Mi ciudad, como todas, tiene barrios. En mi barrio hay un parque con muchos árboles y un carril para montar en bici. Cerca de mi casa hay un centro comercial con muchas salas de cine. Siempre que voy con mis amigos, mis padres me dejan pedir un cubo grande de palomitas y un refresco. Pero lo mejor de mi barrio es mi cole. Allí veo todos los días a mis amigos y amigas. Nos conocemos desde que éramos pequeños y siempre estamos juntos. Cuando terminan las clases, vamos al parque y jugamos a todo lo que se nos ocurre. Nos encanta inventar juegos. A mis amigos y a mí también nos gusta hacer otras cosas. Y a mí me encanta el ordenador, la consola, la tablet. Mis padres siempre se ponen muy pesados y me dicen que tengo que tener cuidado y no hablar con personas.
Let's try to go back to my presentation. Yes. Okay. And cases, recent numbers, last year's cases of sexual abuse attended by a foundation that it takes care of this kind of interventions. Say that the growth rate of cases of sexual abuse against minors in Spain in the last decade has been 300.4%, has increased, and it has multiplied by 4, going up from 2,273 cases in 2008 to 1,093 cases in 2020. And this is our picture. If we at our hospital, we're a very active task force against violence. Here is me and the president, director of the hospital here in the middle, and the rest of our task members that I have already talked about, that we are the members of different services and very active. And this is something that we did many years ago, and we're about to update it for women that have been sexually abused and arriving to the emergency room. Right now in Madrid, we're having a new protocol for hospitals. Before until last year, and only one hospital in Madrid was in charge of receiving women victims of sexual violence. And that really was a double trauma, because women, if they arrived to my hospital, they had to go to Hospital de la Paz to be to get the checkup. And so here, and the medical doctors and the judges arrived to that hospital only for this kind of abuse and assault, sexual assault. So now, right now, we are planning to have this done in the very near future, and explaining the women what do they have to do if in case they have recently assaulted, what are the most frequent reactions, and if other people or family and friends know about this, what kind of responses or support the victims need. And these are some of the protocols here in France. And well, we did present this in a Congress a few years ago. And we have protocols, and we really want to underline that these kind of protocols women need to understand what they are going to be going through during the procedures to get the judges and for their defense. Here, let me check. We did a video that I presented a few months ago during COVID and the other pandemic. And well, I think I will be talking more about what I do. Let me unshare this. And just one thing that I want to say to finish my presentation, that the worst thing that comes to your office is there are kids that have been through this, but women that have suffered, I have patients, adults, that even though I'm an expert, and you need to have a very good training doing this, all through your training as a clinical psychologist, especially in this, because if you're not used to listen to their testimonies, you can show them your impact, and they need to know that there is hope. So I tell my patients that when I watch a movie, I cry. And I usually go to movies with no makeup. But why don't I do not cry in my office? Because I know what to do. And I know they are in my safe space, in my office, and they are giving their testimony. They don't need to tell me all the details, especially if you work with EMDR or other procedures, and that there is hope. And people, even though they can be doctors as victims, they are any type of professions, and sometimes they don't believe they can recover. And I say yes. And not only in my office, evidence show us that there are treatments, especially trauma-focused treatments, and even the trauma has been a long time ago, and they can have the justice done in the treatment they go through with their recovery. And especially for the ones that believe that life is not worth it after being traumatized by their relatives, sometimes their own fathers, or sometimes mothers also, relatives, and they want to die. I say, no, this is a virus that gets through your mind, and we need, if you have a computer and you have a virus, you will never get rid of your computer, right? And they say no. Right. So this is the type of interventions and trauma focused treatments help you to get rid of those symptoms. And the best thing to when they want to also there is a lot of rage, and they want to do something against their abusers, and the best thing to do is to recover, and sometimes to file a complaint. And here, just to finish, in Spain, it will be having a very modern law regarding child abuse and sexual abuse. Women or victims, also men that have been through sexual abuse, they can start complaining, the complaint starting age 35, and they have 15 years to go to start the procedure, the legal procedure. So finally, this is what we need now. Thank you so much.
Thank you so much, Patricia. I could listen to what's happening in Spain all day long because we don't hear very much about it, but we really appreciate what you're sharing with us. The amount of work that you and your task force have been able to do to really help people heal from sexual assault. And I love the hope that you give to victims to become survivors. I'm going to turn now to Brittany Geddes, because I'm so anxious to hear the work that she's been doing as well. So take it away, Brittany.
Thank you. I'm going to go ahead and share my screen. All right, so today I'm going to be talking about how April is Sexual Assault Awareness Month, and so I'm going to be talking more nuance about sexual assault and some of the background information about it. Before I get started, I guess I'll tell you a little bit about myself. So I'm a fourth-year doctoral student at Westchester University in their PsyD program. I'm in the trauma track, so I'm training to be a trauma therapist. I started researching consent and sexual assault in college campuses when I was in undergrad. And then I kind of continued my work with sexual assault research at the doctoral level, which I'll talk a little bit about in my presentation. And clinically, I'm really interested in working with trauma. I have experience working with college students that have experienced sexual assault. And right now I'm working currently at a VA, and I work with military sexual trauma survivors as well. And my experience has been mostly with adults that have experienced trauma. So I think Dr. Villavicencio and I complement each other really well in that sense. Okay, so sexual assault and sexual violence are often used interchangeably to talk about a number of traumatic events that can occur. So all of these little bubbles are all examples of sexual violence. For the purpose of my presentation, when I refer to sexual violence, sexual trauma, or sexual assault, I'm going to be talking about all of these experiences. So I'm going to talk about some statistics of sexual assault. Once every 370 seconds in the United States, someone is sexually assaulted. and that accumulates to 1 in 3 women and 1 in 6 men will be sexually assaulted at some point in their lifetime. If you identify within the LGBTQ community, you are also at increased risk of experiencing sexual assault, as you can see from these statistics. These numbers were pulled from the most recent National Crime Victims Survey and the National Intimate Partner and Sexual Violence Survey here in the United States. It also costs a lot of money to treat sexual trauma because it has such a long-term impact on someone's physical, emotional, mental, and social well-being, as Dr. Villavicencio kind of talked about. And so it costs around $120,000 per victim in the United States, which totals up to $127 billion every year. And the total estimated economic burden of sexual assault in the United States is $1.2 trillion for medical costs, $1.6 trillion in lost work productivity for both the victim and the perpetrator, $234 billion within the criminal justice system, and then $36 billion in other costs. These are some of the health outcomes that are associated with experiencing sexual assault. Most of the time we talk about sexual assault and post-traumatic stress disorder. Sexual trauma is more likely to lead to PTSD than most other forms of trauma. 1/3 to 1/2 of those exposed to sexual trauma will develop a diagnosis of PTSD at some point in their lifetime. It's also been found that there's a higher number of symptoms, symptom severity, and the persistence of symptoms with sexual trauma than other types of trauma. Like I said, we most often talk about sexual assault and PTSD, but the reality is that the mind and body are so deeply connected, and that's important to be aware of how the body remembers and is affected by sexual abuse, which is why I've included some of the physical symptoms as well. Also, especially because survivors sometimes do not remember their trauma, even though it really did happen to them. A huge part of sexual assault awareness is talking about myths related to sexual assault, so I thought it was really important to highlight a bunch of them today. Myths are false beliefs about sexual assault that shift the blame and the responsibility from the perpetrator to the victim, which is what we do not want. And I wanted to bring awareness to these because these messages are still persistent in our culture, and it's very harmful. So one myth is that a person can do something or act in a way that asks to be sexually assaulted. That is not true. People get sexually assaulted doing anything and nothing. It's not sexual assault if the person never said no. That's also not true. If there was not a yes, then it's eligible to be a sexual assault. Dr. Villavicencio also talked about this, but there's a common misconception that perpetrators are usually strangers, pop out of the bush kind of thing. But 85 to 90% of the perpetrators of sexual assault are known to the victim before the assault. Another one is that it must not have happened or must not have been that bad if they didn't report it. The reporting process needs a lot of work, in my opinion, and it's extremely, extremely traumatizing and extremely difficult. Victims often aren't believed. It's really hard to come up with evidence. There's so many reasons why somebody might not report. And so using that as a judgment of if something happened or not is harmful. We also talked about how men can be sexually assaulted, and women can also sexually assault men as well. And that's something that's important to acknowledge. If a survivor changes their story over time or doesn't remember it, it must not have happened. That is also not true and harmful. So sometimes when survivors start their recovery and start their healing process, they have more memories. And the reason why that happens is because for some survivors, they repress the memory. Their body literally chooses to forget as a survival mechanism. So just because there's no memory does not mean that it didn't happen. Dr. Villavicencio talked about this too, about how sexual assault can happen in a marriage or a romantic relationship, and it's not exclusive to other types of relationships. It can happen in any relationship between two people. I just talked about this earlier, but if there's no evidence, there's no crime. That's also not true. Another one is that it's not sexual assault if the person didn't fight back or scream or try to get away. When people are assaulted, they often have a fight, fright, or freeze, fight, flight, or freeze. There we go. Response. And so the fight response is to fight back. the fleeing response is to try to run away, but then there's also a freeze, and that's when your body literally shuts down, it dissociates, it knows that something bad is going to happen, and it's trying to protect your psyche from remembering. And so victims just freeze up. The other one I want to highlight is it's not sexual assault if the perpetrator didn't use violence. Perpetrators often use love if they know the victim, use coercion, use so many different tactics, threatening violence to sexually assault somebody else. I wanted to talk about a little bit about things that are being done to raise sexual assault awareness in the media. So one of them is the women's marches that began in 2017 to bring awareness to the inequalities that still exist for women worldwide, and that included sexual assault and gender-based violence. There's also a lot of films that have started to come out bringing awareness to this issue. These are a couple of like my personal favorites that I've seen, and they all come at sexual assault from a slightly different angle. For the purpose of time, I'm not going to go into all of them, but these are things that you can check out if you're interested in learning more. They're really eye-opening. I also wanted to talk about the Me Too movement. This was initially developed in 2006, actually through MySpace, which I thought was really interesting because that's a throwback, by a sexual harassment survivor and activist, Tarana Burke. So she's the one that originally like coined this term. And it's similar to other social justice movements that involves breaking the silence. And it's the goal of the Me Too movement is to empower women through empathy, solidarity through strength in numbers, and visibly demonstrating how many women have experienced this. So following exposure to the sexual abuse allegations of Harvey Weinstein in Hollywood in October of 2017, we started to see a lot more celebrities being outspoken also about their abuse. And these are some of the brave people that have come forward. This is where my dissertation was actually born from. And so I want to talk about this specific moment in time a little bit. So back in 2018, Dr. Ford, she's a psychologist actually in California, and she went in front of the US Supreme Court and testified about the sexual assault experiences that she experienced. And this is important because this is one of the first times in history that within a criminal justice setting that someone's testimony of sexual assault was broadcasted all over the world. And so after this happened, the National Sexual Assault Hotline saw a huge spike in distress and people seeking out support. While at the same time, there was a lot of people similar with the Me Too movement that came forward and said, she really inspired me. I feel like I can tell my story because she did. And so I was really curious about why this is so healing for some people and so triggering for others. And so my dissertation focuses on the nuances of that, which I will probably present at a different time. But I think that this is important because with the Me Too movement, we're going to see a lot more survivors coming forward and seeking treatment for sexual trauma. And so it's really important that we in the mental health field are prepared to help them. I want to talk a little bit about COVID and sexual assault. So with COVID, it's been more difficult or more risky for survivors to get help. Victims of sexual trauma also may be reluctant to go to the hospital and to get forensic exam to accumulate evidence because of the risk of COVID exposure. There's also been difficulty for mental health services to maintain accessibility during the pandemic as we were all transitioning to telehealth work, especially if the abuse is occurring in the home. And survivors are also often isolated from mental health providers, loved ones, or other people that can really be in a good position to support survivors. I'm also not going to get into a lot of the treatment for sexual assault, but there is research that shows that there are effective treatments out there for sexual assault, which is listed on the left. But I would really encourage clinicians to incorporate some of these on the right. And this is a nod to our international whole persons approaches people, because I feel like I've learned so much about how to incorporate some of these approaches into my work with survivors. And I think something that's important to remind ourselves is that survivors often have complex relationships with their bodies after being traumatized, and they may have difficulty being present in their bodies. And I think that's something really important to keep in mind when we're doing body and movement-based work with clients. But at the same time, helping a survivor reconnect with their body following trauma can be one of the most powerful ways that a survivor can really reclaim their life and heal. So survivors are more likely to report to informal resources, so friends, family, etc., after being sexually assaulted. But there are plenty of times where mental health providers are the first person they're telling, and so it's really important that we know how to respond. So the first one, it's not our job to decide if the facts of the situation is correct or determine the accuracy of the client's memory. Our job is to believe them and to support them above all. With validation and empathy, this sounds so simple, but not all survivors receive that when they disclose in their social environment. And so by providing validation and empathy, we're providing alternative messages to the self-blame, guilt, and internalized victim blaming that survivors often experience. And normalizing has the same effect. And especially in terms of educating, we were just talking before this about how sometimes survivors don't even know that what they experience was sexual trauma, and labeling that for them can be extremely empowering. It also can be really helpful to remind them that they are not alone, that so many other people have experienced this and they can recover, and providing them hope, like Dr. Villavicencio was saying. It's also important to assess how much are they affected by this. So how much does this affect their life and in what ways? And then looking at the level of support. So obviously it's important to assess what level of care do they need, but it's also important to assess what level of support do they have in their environment, in their social world. And if survivors don't have a very supportive social environment, sometimes group therapy and support groups can also be really helpful. And my dissertation focuses on support groups for survivors as well. I really wanted to highlight this because I think it's so important. Being willing to enter into a survivor's experience of sexual assault by experiencing their pain with them, sitting with them, holding it for them is so rewarding, but it can also be extremely taxing on our mental and our emotional resources. So it's important for clinicians to prioritize self-care and their needs so that they're able to help others, especially for trauma therapists. And these are just some examples of things that you can do. I wanted to talk a little bit about how loved ones can support survivors. And I'm going to start a little bit by talking about what not to do. Negative reactions from loved ones after an assault can actually increase depression and PTSD in survivors. And it also can increase self-blame for the survivor and make it less likely that they'll seek out formal support to heal. It also encourages unhealthy coping strategies like substances and self-harm. So this is really important to talk about, especially given that this platform is on social media. I'm hoping that this will also spread awareness to how people that are not clinicians can support the survivors in their life. And the problem is that when loved ones, negative reactions from loved ones are often unintentional. They often do not realize that what they're doing is harmful. One of the things I want to highlight is the second point. When loved ones have difficulty with managing their own feelings related to the trauma, it might lead the sexual assault survivor to caretaking for that person and worrying about their emotional reaction instead of them getting support from you. And I wanted to highlight the last point, judgment, because I think that's also really important. Recovery from sexual assault is a lifelong journey, and it often has some steps forward, some steps back, some steps forward. And so having an understanding of where your loved one is in that journey and not judging them is really important. Some of the things that you can say when someone that you love discloses sexual assault to you is, thank you for sharing. It took a lot of courage to tell me this. You're not to blame for what happened to you. You don't deserve this. I'm sorry that this happened to you. I'm going to support you in this healing process as long as it takes. You're not alone. And so just like letting them know that you're there and that you're willing to let them talk about it when they're ready is really important. It's also really important to believe them. Again, it's not your job to figure out the facts of the situation. It's also really important to let them feel the pain. You can't take it away. You can't fix it. So one of the most powerful things you can do is just sit with them in that moment and not have them experience those feelings alone. And again, continuing to ask them what they need, continuing to check in long after the assault has happened. You can also help them get connected to therapy. And I have some resources at the end that you can use to do that. I want to highlight the very last one on the bottom right. People who love survivors often go through this parallel process where that's similar to the one that survivors are going through as well, but this is often with less support and fewer resources, especially if it fits your child or your grandchild or your sibling or someone very, very close to you. a lot of these people feel like they don't deserve support because the trauma didn't directly happen to them. But it's really hard to hear the stories of someone you love being abused. It's even hard for us as therapists, because we love and care about our clients, to hear about the horrible things that happen to them. And so you deserve to have that support too. And so it might be helpful for you to have your own therapy to process it as well if you need to. I want to kind of end with this is a really big slide, so I'm not going to go through all of them, but some things that we can do as individuals and as communities to try to prevent sexual assault. I want to share a quick story. A couple of days ago, I was sitting in a training on sexual assault awareness and prevention, and somebody had asked, what can I do what can I teach to my child, and what can I tell them to do to prevent themselves from being sexually assaulted? And all of these experts started saying all of these things like, don't consume alcohol, don't walk alone. And it really, really bothered me, because I think focusing on how victims can protect themselves misses the mark. And we have to be really careful when using that language and talking about prevention in this way, because again, it puts the responsibility on the person who was assaulted and not the perpetrator. And it really perpetuates this message that if you were assaulted, you were to blame because you did something wrong or you didn't do something that could have prevented you from being assaulted. And we know from the research that that's just not true. And so the very last thing at the bottom, systemic level change, I really wanted to highlight that, because there really is no way to totally prevent sexual assault without systemic change, without cultural change. And there actually is some things that are being done, more than just what I'm about to mention, but I really wanted to hone in on this. So the current administration has proposed $450 million in funding for domestic violence and sexual assault services. And they recognize that there's added barriers faced by survivors from historically marginalized communities. So survivors who are Black, Indigenous, Latino, Asian American, other people of color. And so this funding really includes funding for resources to community-based organizations that can to help them provide culturally specific services for survivors of sexual assault and domestic violence. The Biden administration and the House of Representatives, I believe this is still waiting to be passed in the Senate, but has reauthorized the Violence Against Women Act. And again, this really is inclusive for Native American women, the LGBTQ community, immigrant survivors, and survivors of color and other underrepresented groups. And the Act supports federal programs that provide services to survivors. It helps to strengthen and coordinate community response to sexual assault. And it also aims to improve the response of the criminal justice system, which, like I said before, means a lot of work. And it also supports prevention programs. So if you or someone you know has been sexually assaulted, these are national and global resources. There's plenty and that you can use. And also if you go onto the RAINN website, it can help you find local resources where you are located. And I'm going to stop sharing my screen.
Wow, thank you so much, Brittany and Patricia. We have had so much information. There is a lot of information out there, and no sexual assault victim should be without the information and the care that a good, well-trained psychology therapist can offer. In my experience, sexual assault victims have the most difficult symptoms to deal with. They last a long time, longer than, as in one of the slides, longer than in other trauma. And there are many people who mean well, but say ignorant things that can make things worse. And I love your kind description of the criminal justice system, Brittany. I think you're just much too kind. Because, you know, when I first started this work, rape victims, if you reported a rape, you were forced to have a test. What am I thinking? I'm losing the words.
The rape kit.
well, besides the rape kit, which is available, and that's appropriate because that does assist. But you also had to take a lie detector test to make sure you were telling the truth. Can you imagine that before a prosecutor would even talk about taking the case, even when the perpetrator was clearly identified? And today we've got so many men of color, particularly Black and brown men, who have been accused of raping white women when we know that the data suggests that Black and brown men, if they sexually assault in their own race, women in their own races more frequently. And it's only because of the false confessions research that's been going on and the DNA that's been collected. That's why rape kits, one of the reasons why rape kits are so helpful. If there is evidence of DNA, it can be preserved. And so it can clear the wrong people because eyewitness identification is often not accurate in those kinds of cases. So there's so much going on. Let me open it up for other people to talk as well.
I wanted to thank both of you for those really great presentations. Brittany, especially, that was so much really helpful information condensed into, obviously a short time for presenting. But I really just want to reiterate what you said about groups for sexual assault survivors and just how invaluable those are as a resource for healing. That there's something about being in a group and the kind of validation and normalization that it provides that, is really kind of something that is hard to provide in a kind of one-on-one relationship with a clinician. There's something about being in a group with other people who've had similar experiences. I think that really can kind of be pretty unique in terms of helping survivors heal. So I just wanted to really, really reinforce that.
Thank you.
Eileen.
Thank you, both of you. Really, really important. And, I hope this gets out to lots of people. I was just wondering if you both could talk a little bit about COVID. I've been doing a lot of work in China where so much the spikes in abuse, partly because people are locked down in close quarters together. And so what you've noticed about what's happening in this country with COVID, and maybe some things you can help us deal with this better. Thanks.
Yes, I think it's so important to remember what both of you have said, and that is that when we think of rape and sexual assault, we think of strangers, but the most of the sexual assaults that we know about occur with people that we've already known. And you can indeed rape your wife. If she says no, sexual permissiveness does not necessarily come with a marriage license. She has the right to say no at any point. And so a lot of the people who are in lockdowns are experiencing the tensions, and sometimes it's not physical, but it's coercive, that somebody is coerced into having sex when they don't want it. And in many battered women's cases, it avoids some of the injuries from serious physical assaults to allow him to have sex, because that may calm him down. And women have known that forever. That's one way to keep men from being too abusive. Marilyn, did you want to share?
No, I wanted to say that in the New York Times, I think it was last week, that they said that reports of sexual abuse, assault, have gone up about 30% during this period of time, which they think is an underestimate because these are reported cases. And if you're locked in a situation with your assaulter, the chances of you reporting it are much less, since you cannot get out of that situation.
You know, it's also true for women who are sexually assaulted at work or harassed at work, and they don't want to tell their partner at home what's happening. And so if you're constantly with your partner at home, you don't have the privacy to make those kinds of reports. So it's interesting, even without being able to, it's still so high.
And also, I have to add about girls and boys that are suffering sexual abuse during the lockdown and the COVID pandemics. And they might not be able to not even know about the resources or talk to their teachers or other adults that they could trust. And they are, I have to say it again, there are ways to get out of that situation, as there are laws against it, and many people that care about your health and well-being. So please don't be afraid of sharing this. Even this has happened in the past, you need to say and share this, because pedophiles and sexual abusers that do this to young children keep doing it through their lifetime.
I'm thinking about if one of you, probably Brittany, because this would be an American thing. I've worked with a couple of women in the military, and that was a huge problem with them, and the desire to sort of repress the fact that it was happening. And I think there's new legislation now that's willing to really help women and look at it. Can you say something about what's going on in the military, Brittany?
Yeah, so I that was actually part of the training I sat in. I think that there's still a lot of reform that needs to happen within the military, but I do think that the military has come a long way in recognizing that this has been an issue for the test of time. And I think you actually see a higher percentage of men being sexually assaulted in the military compared to civilians. And I think that's actually true for women as well. But I also think, so I worked there for the Veterans Health Administration, and they also have a huge campaign for sexual assault awareness within the military. And that includes like time in the military, but also like trauma you've come in with. And it also includes like not just like while you're in the military, if it happened while you were at work or whether you were deployed. Like there's so many different situations that qualify for military sexual trauma. And so the VA has like a lot of resources, and actually at the Philadelphia VA where I work, they do a pretty large screening, even in like normal doctor's office visits, asking about these experiences. But you remind me of something really important, especially when it comes to talking with men that have been assaulted. Sometimes we have to ask multiple times before they're ready to tell us. So just because you ask once and get a no doesn't mean it didn't happen, and really use your clinical judgment, because there's likely going to be other indicators that tell you that maybe there was abuse.
Thank you.
There's also on my task force, we have some of the military people who have been writing apps for dealing with trauma. And one of the apps on sexual harassment is available on this for use on the smartphone, to work either alone if you can't get to a therapist, or to work with a therapist for military members. I don't know whether it's available for civilians yet, but it's very exciting to see some of this that's happening, because rape is such a, given all of the Victorian attitudes, let me put it that way, that we still have about sex and sexual assaults, it's very difficult for many people to talk about. I just read that in the military, they're now proposing the change from reporting sexual assaults to a superior officer to somebody who's outside of either outside of the military or outside of their particular unit, which I think is critical to be done, because the split between officer and enlisted person in being able to deal with sexual assault is huge. Enlisted people have an easier time getting redress. Not so for officers. They're more protected.
And just one other thing, before we end, which is now.
Yeah, we're
Just
about to
wanted
end.
say something about next week. So we have a wonderful presentation. It's also about what's going on in some of these institutions. So Dr. William Foreman, who is a student of mine, has been working in the prison system for many years.
Ah.
And so we're going to we'll have a chance then to ask him questions about, we hear all kinds of stories about what's going on in the prison system, and especially during COVID and sexual assaults. So I think we can continue this conversation about some areas that most people don't really get to know a lot about what's going on. So stay tuned for
exciting.
next week in the prison system. We'll be talking about that as well with Dr.
All
Foreman.
right.
Mhm.
Well, we're going to have to end. We're a few minutes over time, but it's been a really important, informative discussion. And next week, we will continue looking at another institution and looking at what's happening in prisons during COVID. So everybody have a very safe week. If you haven't been vaccinated yet, but you can get vaccinated, do it.
Also
Definitely.
follow us on COVID IPV and International Whole Persons Approach. Follow us on Instagram, on Facebook, and ask other individuals to come and follow us as well. Everything is usually posted on both the advertisements and things like that of our next roundtable. So please follow us.
Same links each week.
Mhm.